Thank you all for being here today on Monday, July the 13th. As you all know, that today we have stricter measures going into effect in 13 counties as we face down the threat of COVID-19. We have suspended elective procedures in our hospitals to prevent them from becoming overwhelmed. You know that I have pushed back in past months when people claimed that an increase in the number of cases was a spike in Mississippi. To my fellow Mississippians, I urge you to please make no mistake. We are in the middle of a spike today. In those 13 counties, we've put additional limits on social gatherings. We've said that masks are required at public gatherings and in retail environments. I'm asking every Mississippian to please join us in attempting to help us slow the spread of the virus. I hope that throughout this, people have been able to see me as an honest broker. I have avoided hyperbole at all times. I have never said anything in an attempt to scare people, only to plainly state what we are seeing. There are plenty of people who have said that we have not gone far enough. There are also plenty of people who have said we are going too far. I've always tried to show restraint. I've also taken steps I never imagined I'd have to take. I say all of that in hopes that people will trust me when I tell you this is the worst that it has ever been for spread of cases in our state. It is the most stressed our hospital system has been to date. Right now, there is a backlash against coronavirus mitigation. It's understandable. The sky's falling predictions of the spring were not realized. But we need to understand that that is partly because there were some who spun themselves up and could not control their rhetoric. But it's also important that we understand it is mostly because back then, just a few short weeks ago, we all took the coronavirus at least somewhat seriously. Some took extraordinary measures to protect themselves and their loved ones, but everyone was willing to do something. Right now, it seems like there's a good number of people who have resigned themselves to spreading the virus, or they believe that it is not real. I hear that all the time. I'm telling you, it is real. It is very real. You can see it in our death toll. We, as a state, are in the thick of things. The best way that we know to avoid the shutdowns of schools, sports, and work right now is to encourage you to wear a mask. I know that some people have trouble believing that. There was a concerted push at the beginning of this pandemic to discourage mask use from the highest levels of our government and from the highest levels of our health community. It makes guys like me, who are already skeptical by nature, have a hard time believing this time around. But I want you to know, I am here to tell you, I have directly asked every hard question you've wondered about. Why the change in tone? Are masks really effective? We've looked at every available tool. And I promise you this is the best weapon we have right now. It's not fun, but it's a hell of a lot better than widespread economic shutdowns. And if we don't do something, that's the trajectory that we are on. The president is wearing a mask. I'm wearing a mask. We're all doing it. It's got to happen, or we're going to find ourselves in a place as bad as we talked about in March and April, and as bad as we can possibly imagine. Scientists throughout this have sometimes gotten things wrong. Models have been flawed. Experts and pundits have been overly confident and overly dramatic at different times. That whiplash is confusing. I get it. It's been confusing to me at times as well. But I'm telling you, where we find ourselves today, this is not a hypothetical. We don't know the effects of this virus from experiments or from other states. We're seeing it right here, right now. The virus is deadly. It is spreading. In fact, our experts believe we are witnessing a more contagious strain tear through our state right now. It's above my level of expertise, but they've analyzed it. They believe that the virus is mutating, perhaps even more contagious, and maybe even getting more powerful. This is Mississippi's moment. This is our time to fight. I believe it's coming for every corner of this country, but it's coming at different times. This is our time. We are in the middle of our time. I urge you, stay calm, but stay in control. Do not panic, but persevere. We can beat this thing working together, and we can save lives. I would submit to you that is what you are doing every time you choose to wear a mask. Every smart move you make, every sacrifice you make, every little action you take, the end result, you are helping to save lives. I believe in my heart we can do this. I also believe in my heart that we have to do this. We will come through this, but only if we are committed to one another. We will come through this, but only if we're committed to working together as one. Dr. Dobbs, would you please give us an update on our numbers?
Thank you, Governor. Today we're reporting 393 new cases for a total number of 36,680 coronavirus cases. We're reporting one death today and a total death count of 1,250. Keep in mind that likely represents a weekend reporting drop. Wouldn't count on this being a trend. Certainly we'll continue to follow this closely. If you look back at the data over the past several weeks about date of onset when people first became ill, you'll notice that on July 8th, we had by far the largest number of people reporting that they were ill at 1,071. Not coincidentally, that's exactly 4 days from July 4th and the weekend, and the incubation period is 4 to 5 days. So we're certainly very concerned that we're going to see ongoing cases related to holiday festivities. As a little bit of Mythbusters, I would like to go ahead and say a couple things real quickly. Every time you test someone, it doesn't matter. One person is one case. People ask me over and over again, if we test someone 3 times, does that count as 3 cases? Absolutely not. If we test someone 20 times, the same person is going to be just one case. So there is no case inflation for number of tests by individual. Please, we need to set that rumor to rest. The other thing is people have asked about is the antibodies. Are we driving up our case count with antibodies? Absolutely not. Of our total 36,680 cases, 285 are from antibody tests. So it's a small number, and it's only people who have a positive antibody test and either symptoms consistent with coronavirus or a known personal contact. So that's not driving up the numbers. It's coronavirus that's driving up the numbers itself. If we look at hospital utilization, it's something we continue to watch with great concern. We've had an increase in total cases hospitalized, 758 confirmed cases today with an additional 262 suspects for a total number of 1,020. If we look at our ICU utilization, that has increased as well to 208, and ventilator use has increased to 110. Again, things that we are not surprised about and predicted because the hospitalizations and deaths follow over time from when the cases start elevating. If we look at bed availability in the Jackson area, there are 4 hospitals currently with no intensive care unit beds available. In the state, there are 8 hospitals with no ICU capacity available. I would like to commend hospitals for adding capacity. 4 Mississippi hospitals have added ICU beds from their surge capacity and are staffing them to meet the need of Mississippi patients. This is something we'll continue to work on aggressively, and we're actually working on making sure we post information on our website about the number of beds and how many beds are available by region, ICU bed capacity, total beds, that sort of thing. I understand there's a great interest, and so we'll try to get that out to everyone very soon. We continue to work on our case investigation, trying to identify as many people as possible and get them on isolation orders and then quarantine orders for their contacts. Across the country, there has been a delay in testing, which undermines this effort somewhat because obviously if it's a 7 to 10 day lag, the person's no longer contagious by the time that we oftentimes find that result. But that's something we'll work aggressively on. The state public health lab has not been affected by that, as we've not had the same sort of influx of testing from hotspot states like Texas and Florida. Those have overwhelmed the commercial labs, and we've suffered for that. As you can imagine, we continue to add nurses and other public health professionals to our contact investigation teams and expect to see more from that as well. Thank you, Governor.
Thank you, Dr. Dobbs. Since we're in the, since Dr. Dobbs brought up an attempt to dispel some of the popular rumors that are out there, I want to just for a second talk about herd immunity. I've heard that repeatedly by a number of folks in saying that the only way in which for us to conquer this virus is through herd immunity. I just want to put some numbers out there. I don't know much about the science, and I don't know much about being a physician, but I'm pretty good at math. Our experts tell me that herd immunity means somewhere between 70 and 80% at least of the people have contracted the virus. Let's just for a second say that our experts are wrong by half. So rather than saying 80%, let's say 40% of our people would have to have contracted the virus for us to have herd immunity in Mississippi. We have 3 million people in our state. 40% of 3 million is 1.2 million people. We've had 36,000 cases. So if our experts are wrong, in fact they're doubling the amount of people we'd have to get, just for instance, we'd have to see 1,160,000 more cases to get to what they say is half of herd immunity. We've received 36,000 cases in March and April and May and June and July. Just those 36,000 cases over a nearly 5-month period have led us to a situation in which our hospitals are at capacity. Can you imagine what would happen if we had 1,160,000 more cases over the next month or 2 months or 3 months or even over the next 3 years? Herd immunity as a solution does not work. It doesn't work in our state, and I don't believe it works anywhere else, unless you're comfortable with literally tens of thousands, probably hundreds of thousands of Mississippians who need medical care being unable to receive it. That is not a strategy worth considering, in my humble opinion. With that, I'm going to turn it over to Director Michelle, who's going to give us an update on some of the emergency declarations that we have asked the White House for, one of which we have recently gotten.
Thank you, Governor. I appreciate it. Real quick, before I go into declaration update, I just wanted to hit on again something that I was asked about at the last press conference on Thursday about PPE, given the availability and given the fact that we've seen these spikes in cases in an area that we at one time anticipated might go down a little bit. The answer to that question is we are not in any concern about availability of PPE. If you remember, we've been talking about the replenishing the state stockpile, which we have been working on doing that over the course of the last few months. And that is what the stockpile is there for, just to go into whenever we need it. So we have been going into some of that inventory, but we are replenishing that as we go. So we are in good shape right now with PPE to get us through. I want to remind the state that our priorities for our issuance of PPE have remained unchanged. We are still prioritizing our PPE pushes to Tier 1 and Tier 3 entities. We have been helping entities where we can with PPE, such as the community mask program that we've supported, but I just want to remind everybody that our priorities of PPE pushes remain unchanged. With regard to the federal declaration update that Governor Reeves discussed earlier, we did get an announcement on Thursday that we were approved for the federal declaration for damages that came about as a result of the tornado outbreak for April 22nd and 23rd. Those counties that were approved for public assistance declaration were Amite County, Claiborne, Covington, George, Jefferson Davis, Jones, Lawrence, Pike, Simpson, Smith, and Wayne counties. If we do have additional counties that need to be added to that, we can if damages are provided, and the applications are already open on our website, on FEMA's website, to be able to start applying for public assistance. And Governor, that's all I have as updates for today, sir.
Thank you, Director Michelle. I would also like to announce here at this press conference something that I think either has or will very soon, a new release from my office stating that I have made an appointment for a new commissioner at the Department of Revenue. I have made the decision to appoint Chris Graham to that position. I'm extremely pleased for the people of our state and also for the people of that department that Chris has accepted this new challenge. He has spent the better part of the last 10 years working in state government. His background is ideally suited to run the Department of Revenue. He has an undergrad in a Bachelor of Accountancy from the University of Mississippi. He also has received a Master's of Accountancy from Millsaps College, and he also attended law school at the University of Mississippi, practiced law for the better part of the last 17 years, as well as working most recently at the Mississippi Legislative Budget Office, coming to them from the Mississippi Ethics Commission. He is going to do a fantastic job as our new Revenue Commissioner. I'm proud of him for taking on this new challenge, and I look forward to working with him and our legislative leaders to continue to improve the overall fiscal status of our great state. With that, I will turn the floor over to questions. Courtney.
Governor, you obviously the new order taking effect today, but both you and Dr. Dobbs seem to be hyper aware of just how much misinformation, rumors, all this that is out there. How important is it to get that information out there while also thinking about how well this new order can be enforced? I know you've talked about the challenges with that, but if people still are getting that misinformation and just think, well, I won't really get ticketed or whatever the case may be.
Well, what I would say is people in Mississippi are in general skeptical, and I am too, and I think that's certainly understandable. But let's think about where we find ourselves today. We spent March and April really talking seriously about the dangers that could come. And the fact of the matter is that we were able to slow the spread considerably, probably more so than we expected that we would be able to in March and April and in early May. Because of that, we did not find what could have been a catastrophic outcome during that time. It happened in New York, it happened in New Jersey, but it didn't happen in Mississippi. And so you take a naturally skeptical people who said, look, we did all of these things, including 3 weeks of shelter in place, and really it wasn't that bad. Add on top of that, we had some people, for whatever reason, that were saying in March, and not necessarily here, but across the country, quite frankly, across the globe, that wearing a mask really wasn't that important, that maybe it would not even help stop the spread of the virus. That was said early on, and there were a lot of reasons for that. But you take an already skeptical people, and they're even more skeptical now because the advice that they believed or were given back 5 months ago is different than the advice that we're giving now. And so I fully understand and fully appreciate those who remain skeptical. All I can do is say to the people of this state, I'm telling you, trust me on this. This is a real issue in our state. We are looking at a scenario in which 2 months ago, when we had 450 cases It was the largest ever that we'd had, and we were concerned about it. Today we're saying we only had 400 cases yesterday, but it was just because it was Sunday. And the day before that, and the day before that, and the day before that, it was extremely larger than that. And so we believe at this time that by wearing a mask, you can not only protect yourself, but you can protect others. Is wearing a mask in public foolproof? Does it guarantee that no spread's going to occur? No, it does not. But it can go a long way towards helping. And when you combine wearing a mask in public, socially distancing, staying at least 6 feet apart at all times, and you combine that with the other measures that we have in place, it can make a real difference. And where we find ourselves in our cycle, because remember, we went up and then we went very flat for 2 months, and then we started trending down, and then late May occurred, and then we turned, and now we're doing this, and we're doing this, and we're still going up. And so what we've got to do now as a state and as a people is we've got to decide, we've got to get back in that mentality where we slowed the spread in April and May. Because if we don't, if we continue on that trajectory where we find ourselves now, we are going to be in a scenario like we tried foolishly to avoid, or not foolishly, but correctly to avoid, that we saw in New York, where you had a huge spike, and then there were literally people that were not able to get the quality of care that they needed, and they had a large number of deaths because of it. And so I think when you look at the new order, these are just words on a page. If nobody adheres to it, then there's not anything we can do about it. I'm not going to be able to be in every community and say, you've got to do this and you've got to do that. And oh, by the way, these individuals across the state who have decided that, hey, we're going to mask shame you on either side. We're going to shame you because you're wearing a mask, or we're going to shame you because you won't wear a mask. That is not helpful. Every Mississippian has to get it through their own head that this is the right thing to do. Are we going to get 100% compliance? No. But if we can get 80 or 90 or 95% compliance, it will go a long way towards helping us. And so what I'm trying to ask my fellow Mississippians to do is to recognize that in a state like Florida, for instance, yesterday they had over 15,000 cases reported in one day. We don't want to be like that here. We don't want to see that kind of spread happening in Mississippi. And so we are trying to take action now to avoid having days, a week or 2 weeks or 3 weeks from now, of 3,000 or 4,000 cases a day every single day. Because the thing we know for sure is, as Dr. Dobbs has said, because we have 5 months of data to prove it now, hospitalizations and ultimately deaths are a lagging indicator. New cases occur, people enter the hospital, a percentage of them get on ventilators, and unfortunately a fairly healthy percentage of those do not ever get off of the ventilator. So as you see the number of patients in ICU beds rise, and you see the number of patients on ventilators rise, and the 110 that we have today is a lot more than the 68 that we had a month ago, a lot more. And so we know that some of those are going to be bad outcomes, and we want to minimize and mitigate the bad outcomes. Yes, ma'am.
I think there are some people asking why not just make a statewide mask mandate instead of 13 counties.
I think there are some people who are asking that. I agree. We believe this is the best tool at this time. We believe that those 13 counties that we identified late last week are the 13 counties that have had the most transmission. We did not pick these counties out of the air. These counties either had at least 200 cases in the previous 14 days or had an average of over 500 cases per 100,000 residents. And so you had to fit one of those two categories. Now, I will tell you, over the weekend, we've had additional counties that met those same criteria. Dr. Dobbs and his team and I are reviewing those additional counties to decide if we want to add them on to this order. What we hope everyone will understand is that now is the time, if you go into public, wear a mask. If you are in the vulnerable population, if you are over the age of 65, if you have a pre-existing condition, we urge you to stay home. All of the measures that we had previously put in place are still in place. Capacity limitations on restaurants, for instance, are still in place. No more than half capacity. We're now adding on, if you're in public, we ask that you wear a mask. We think it will help long term, slow the spread of the virus. Sometimes, if you're in a more rural part of our state that has not seen the kind of transmission, maybe you don't personally know anyone who has the virus or has contracted the virus, it can sometimes be counterproductive for us to put government mandates on people. But what we can tell you about these additional 13 counties, Hinds, Rankin, and Madison here in the central Mississippi area being 3 of them, is that the number of cases justify additional action. That we feel very confident about.
When it comes to enforcement of this, did the counties choose the citations or tickets or whatever that goes into enforcing this?
Yeah. So the most difficult thing throughout this process is enforcement. It's very difficult. We try very hard in our state to enforce our murder statutes, but the reality is there are murders that occur in this city and others on a certainly weekly, if not daily basis. The fact of the matter is we are allowing for state law enforcement, county law enforcement, city law enforcement, and others to help enforce these additional measures. But the single most important enforcement mechanism is for individuals who have a willingness and a desire to follow the law, and this is an executive order. It is the law of the land in Mississippi under our emergency statutes. The vast majority of Mississippians want to follow the law, and so in this instance, in these 13 additional counties, following the law requires one to wear a mask. I saw some good things happen over the weekend. I think we saw more and more people in these counties and in other counties actually wearing masks. I received many reports of that. Not everyone, not full compliance, but more and more people are beginning to understand the importance of this. I saw good, strong legislators in counties like Rankin working with our supervisors who had worked with our emergency management team to have community masks. They actually handed out masks yesterday at Northwest Rankin High School, for instance. That's one such place that I know occurred because our supervisor, Mr. Cross, and our state representative, Mr. Powell, and our state senator, Senator Harkins, Congressman Guest, all showed up at Northwest, handed out masks to the community. We have community masks that we can work to get to people in these 13 counties or otherwise. We want to do everything we can to make compliance as easy as is humanly possible, and we know that there is no such thing as it being easy. Renee?
Jack of Clearing Ledger has a question.
Yeah, I've got a question for Dr. Dobbs. Dr. Dobbs, I know in the past we've talked about staffing levels at some hospitals. I know you mentioned that I believe it was 8 total hospitals in Mississippi have their ICUs at capacity right now. Are you having any issues finding enough medical workers right now as cases spike?
We certainly have heard from different hospitals that is a real challenge, and it's not a challenge just because of the number of healthcare professionals, but also the type, right? So ICU nurses, respiratory therapists, those are in pretty tight demand. And then, as we look across the country trying to find staffing services, there's also a demand for those in states that have a lot of other cases like Texas and in places like that. So it is a challenge. It's not one that's insurmountable at this moment, but it's something that we're looking at for the future and doing some contingency planning. A lot of folks are paying extra money for extra shifts and that sort of thing. So we haven't exhausted our existing capacity, but it's something we're very concerned about.
Dave Elliott with Patrick McGee with Sun Herald has a question.
Yes, Dr. Dobbs, I heard that Governor Reeves mentioned the possibility that there's a more contagious strain working its way through the state. I was just curious what you had to say.
Yeah, so there was an article in the journal Cell, which is a very reputable, high-powered journal, that looked at trends. It wasn't so much in Mississippi specifically, but it has more global implications. That there was a subtle genetic mutation on the surface protein of coronavirus that, based on their analysis, is more contagious. It seems like a pretty legitimate concern. I do think we'll learn more going forward, but I think that it's quite plausible.
The article that I was referring to was actually specific to Houston, Texas. But let's just to be fair, the original coronavirus that we were dealing with in March was mighty daggum contagious. So even if this is only slightly more contagious, it is still spreading very, very rapidly in a large number of states.
Taylor Vance with the Daily Journal has a question.
Yes, I have a question for Governor Reeves and Dr. Dobbs. Governor, you recently signed a bill into law that would allow people to vote absentee in the upcoming election if they are under a physician-imposed quarantine or if they are caring for someone who has contracted COVID-19. And do you think that this law is sufficient to ensure the safety of voting precincts in November, or do you think there should be more work done to ensure that they are safe for people to vote in person? And Dr. Dobbs, I'm also just curious what your thoughts are about the safety of precincts for the upcoming November election.
Well, thank you for that question. Yes, we worked very closely with Senator Branning, Representative Beckett, as well as other leading members of the legislature with respect to that legislation. I personally believe that we took good, solid steps to ensure the safety of all Mississippians. In addition to that, I have been in contact fairly regularly over the last several weeks with Secretary of State Michael Watson and others. There are monies available, and we are going to ensure that we have adequate PPE for all of our workers for the November elections. And obviously, as we get closer to that, we will continue to make and monitor that situation. I will tell you that we've had elections that have occurred in Mississippi over the last 30 to 60 days. We'll have more elections occur in the next 30 to 60 days, and we're going to do everything in our power to make sure that we protect all Mississippians and give them the opportunity to vote in such a way that that they can feel good about it and also feel safe.
And certainly, I think we know the safety measures that you can take at any location, right? Polling place or wherever it might be. Proper spacing by wearing a mask, hand hygiene absolutely have to happen. There's just no way we cannot do that to fidelity. So I have confidence that by and large that we'll be able to do that, and would like to encourage everyone to exercise their right to vote.
Yes, sir.
Yeah, for Dr. Dobbs and you, Governor, when it comes to long-term care facilities, what are we seeing? What are y'all's concerns? And then I guess two more questions is why is this happening, and how can we slow the spread of disease in long-term care facilities?
We're seeing more and more infections and outbreaks in long-term care facilities. Again, not a surprise, right? I mean, they reflect what happens in the community, and the people who work in long-term care settings, nursing homes, are the same people who live in communities where coronavirus is being transmitted. So we are doing a lot of testing in different scenarios, supporting them in outbreak testing, looking at what future opportunities might be there. We're all connected. If you're 20 years old and you're bored of sitting around home, you going out and party and may inadvertently kill somebody else's grandma in the nursing home as you perpetuate the pandemic. So It's a community response, for one thing, if we all will do right. And then we're doing everything we can. We have great nursing home leaders trying to do everything they can to protect their residents, but there will be deaths until we can get this thing under control for sure.
Dave Elliott with WOX has a question.
Thanks so much, Renee. Governor, the Department of Marine Resources at this moment is on borrowed time. They're working off a temporary operating budget. It expires Wednesday. You're not going to be able to bring lawmakers back for a special session because of cases among legislators. So, DMR's budget is on thin ice. What can you do to keep the agency afloat beyond Wednesday?
Thank you, Dave, for the question. We are committed to ensuring the safety of all Mississippians, and there are many missions that the Department of Marine Resources conducts. Certainly the law enforcement side of that on our Mississippi waterways is critically important. But not only that, there's also critically important task that they perform to ensure that federal guidelines and federal laws with respect to fishing and otherwise are enacted. And so we are looking at our options to extend the temporary measures that we've put in place. I am confident that we will be able to do that. But at some point, it is going to be incumbent upon the individuals on the Mississippi Gulf Coast to convince their legislators, particularly in the House, that they don't have the votes to do what they want to do, and therefore it is time to pass a clean budget for the Department of Marine Resources so that we can get all of those individuals back to work, because that's what those families that live amongst our friends on the coast deserve. Cornyn.
Governor, back in March, schools closed when there were far fewer cases. Now that we are, as you said, continuing to see an upward trend, why give the green light for schools to let students go back in when we're seeing more cases than we did when we initially closed them?
Yeah, that's a good question, Courtney, and I appreciate it. A couple things that I would say. Back in March, when I initially made that decision, and I have said, and it continues to be the hardest decision I've made as governor, may be the hardest decision I've ever made, but certainly in my, at that point, 3 months as governor. At that time, we did not know exactly what the long-term effects could be. We didn't know that we'd be able to slow the spread at 300, 400, 500 a day, which is what we were able to do there for a long period of time. We are looking to see how much compliance we can get with our mask orders in these 13 counties. We're looking to see if we can be successful at slowing the spread over the next several weeks. I have said from the beginning of this is a fluid situation. Every day brings new information. Every day brings new data. Some days it brings data that is good. Some days, certainly the last several, have brought a lot of data that is not particularly good to see. And so I do think it's important that we get our kids back in school. I believe it's very important for everyone to understand that we can do it in a safe, responsible way. But we're going to continue to monitor it, and we're going to continue to work with our school districts. We've asked for and received numerous plans from all across the state on what I would call their various phases of how they get kids back in school, and because I think there's a general consensus that we need to get our kids back in school. We cannot go for years and years on end without having our kids learning and setting them back for the rest of their life. That's not a plausible option. So we've got to find a way to do it safely. We've got to be smart about it. We've got to be willing to be flexible and make a decision today that we may have to tweak tomorrow. It's just the nature of a pandemic. I hate the fact that we're dealing with it. Maybe not as much as the 3 million Mississippians hate it, but I promise you this is not what I wanted to do the first 6 months of my tenure as governor. But here we are. And we got two choices. We can either deal with the circumstances as they exist, be realistic, be honest with the people of the state, and work together to find a solution, or we can ignore it and things will get much, much, much worse.
Dr. Dobbs, some people are asking for you to clarify what they're supposed to do when they get their coronavirus test. Are you supposed to go back to work? Are you supposed to quarantine yourself? Because some bosses are saying you need to come back.
So it's a good question, and it's a nuanced answer. And on our website, we do have some guidance for employers. So if you're getting tested because you're ill or have symptoms, you need to stay home. There's no doubt about it. If you're testing because you're exposed to somebody who has coronavirus, you need to stay home. But if you're part of a mass testing event and you're asymptomatic and don't know anybody who you've been exposed to, you don't have to avoid work. We've had some scenarios, and certainly that's great for people to just get tested because they're worried. But if you're just getting tested to get tested and you're waiting on it, you don't have to miss work. But if you are symptomatic or if you're a contact to somebody who has coronavirus, you need to wait. You need to stay home.
Mr. Droppins with the Gazebo Gazette has a question. It's not unmuting. Joey Barnes with WCBI has a question.
Dr. Dobbs, today OCH Regional Medical Center sent out a tweet saying that their drive-through testing would no longer be done because there is a shortage of supplies. Is this something that we're seeing maybe only at that facility, or is that something you're seeing throughout the state?
Certain commercial labs have had supply issues. We don't have any right now with Department of Health. I mean, everybody has different sort of supply chains and different ways of getting it. There is no supply of things that is inexhaustible. And if we continue to play chicken with this pandemic, we're going to get burned over and over again. So, certainly we're going to have spotty supply shortages. I'm afraid as we go into this, we'll continue to fight it. And I don't think it's a major sort of system-wide issue, but certainly something we're watching very closely. But from our public health response, we do have supplies, and certainly I think that the private guys will get resupplied because we've had a massive pull of supplies going to Florida and Texas. And just like the PPE thing with New York and New Jersey and all that, we're kind of a little fish in a big pond, and we're going to be affected by the big guys.
Just to put things in perspective, if the state of Florida had 15,000 new cases, if they had a 10% positivity rate, which is about above where we want it to be as our state or as any state, but if they had a 10% positivity rate, which theirs is probably much higher, but if it was 10%, that means they did 150,000 tests that day. That's a very, very, very large number of tests. But if it was 20%, then that means they did 75,000 tests that day. All of that takes up all of the different supplies that it takes to do the test, and so supply issues could become a challenge if we don't start doing the little things like wearing a mask in these 13 counties and really wearing a mask statewide so that we don't have to enact more mask mandates in other counties.
One thing I would like to add to that. Once you test positive, please don't test again. Your test will stay positive for like weeks and weeks and weeks, and you're only contagious for 14 days. So there's really no need to get tested again. I mean, there's some employers we know and some other scenarios where people want to get multiple tests until they're negative. It'll just drive you nuts, and it wastes tests. So you get one test, it's positive, there's really no need to test again.
Renee.
Taylor Vance with Daily Journal has another question.
Yes, I have another question for Governor Reeves and Dr. Dobbs. As school districts around the state are starting to release plans for how they plan to reopen their schools, what guidance would you give to the Mississippi High School Activities Association as they're trying to figure out what to do about fall sports and other activities?
Well, we're continuing to monitor the situation as it relates to fall sports. I know that Dr. Dobbs and his team have released guidelines as it relates to getting back in school. I will tell you that my priority is that kids are in school learning, and I will tell you that large gatherings of thousands of people in the stands to watch high school sports is going to be problematic in the fall unless we see a dramatic decline in the growth rates of the number of cases that we have in Mississippi. There's just no other way to couch it other than that. It is very important that we, again, understand that we are currently in the middle of July. The fact is that we have been able to move towards more normalcy in June and in the early part of this month. But the fact is we're seeing rising cases, and we've got to be smart about what we do going forward. My priority is getting kids back in school so they can learn, but I also understand as a father of 3 daughters who love sports, I also understand that they are important, but it's very possible that particularly with fall sports, they're going to look a little bit different this year than they have in years past.
It's a rapidly evolving situation, right? So things are a lot worse now than they were a month ago. And so the decisions that were being contemplated in June were very different than things we're talking about now. So, certainly certain athletic and other activities can happen safely or mostly safely. Crowds of people, whenever you have crowds together, you have high risk. And I think that's going to be the main thing. And how far do you mitigate that risk is going to be the central question as we go into the fall.
A couple of update questions, some coronavirus related, others not. Dr. Dobbs, for you, do we have any updated numbers on the Capitol outbreak? I know you said that you all were still trying to figure out kind of the ones who had been tested in their district. And Governor, for you, have you made any decisions about your appointments to the Flag Commission? I know that we've got just a couple of days left on that.
I apologize. We have had several additional cases I've been notified among legislators, but it has slowed down. We're not seeing a lot more. I can get with the EPI team to try to get updated numbers, but I'm sorry I don't have that with me.
I don't have any update on the Flag Commission at this time.
Hunter Dawkins with PB Books.
Thank you, Renee. Thank you, Governor. I'm sorry I was a little bit late today, but I have a question for not only for Governor Reeves, but also for Dr. Dobbs. The question I have for you, Governor Reeves, is what, and I may have missed this earlier, but if mandating these masks in specific counties, especially mine on the Gulf Coast, what's the penalty going to be like for that, for those that have chosen not to? And also, with you, Dr. Dobbs, the question I have would be, because of this mutation device, flu that is pretty much came from COVID as well, or another version, would you say under the scientific guidelines that you've gone through, or from scientists that spoke to you, if this was a weaker version of the COVID or not?
I'll start with attempting to answer the question. We have in our executive order, which has the force of law in the land, we have 13 additional counties. Many of the guidelines are similar to what we've had in the past in other counties. We do allow for all businesses shall attempt in good faith to follow the guidelines from both the State Department of Health and the CDC, asking employees questions. That's true of all businesses, but it includes retail businesses as well. The gatherings, we are limiting gatherings to less than 10 indoors and less than 20 outdoors in those 13 counties. We are encouraging those who cannot socially distance to wear masks, but also if you wear a mask, it's even better whether you can socially distance or not. But if you're not going to be within 10 feet of another human being, you're probably not going to spread the virus to yourself. But if you're going to be in large gatherings, it is important, in fact, it is imperative that you wear a mask in those 13 counties. When it comes to the social gatherings, we're asking local law enforcement to help us break up those social gatherings. If you know that there's a party going on with 50 or 100 people, at one indoor facility. We're asking them to help us break that up. You don't have to arrest anybody. Just send them home. Get rid of them. Have them go their merry ways. This is critically important that at this critical juncture in our fight against COVID that we all work together to make this happen.
And as far as the strain that has been analyzed, there's no indication that it's less deadly. I mean, one of the things that's happened is we've seen a lot more young folks get sick, right? And they're not going to get as sick, and that's not surprising. And so that'll make our mortality look a lot better. And I think also our medical treatment and our acknowledgement of what to do is actually getting better as well. So those are going to be beneficial bits. We're going to continue to have different things that are going to be hopeful that we're going to want to have excuses to not do the hard stuff. But I don't see any sort of silver lining ahead for us. You know, the summer was supposed to get rid of the virus, right? It didn't work out that way. I'm also going to answer a question you didn't ask about the elective procedures. I just want to clarify. The prohibition against elective surgeries only applies to people who require overnight hospitalization. So if you need a mammogram or a colonoscopy, or if it's a same-day surgery, all those things are good. That's fine. We're just trying to preserve hospital bed space. So I know there have been a little bit of misunderstanding in the public. So please don't cancel your appointment. Talk to your doc. Make sure, because unless it requires an overnight hospitalization, you're good.
Yeah, just so we are clear. We canceled more elective surgeries than that back 2 or 3 months ago, but that was a PPE issue. We wanted to make sure that we preserved PPE for our healthcare workers. Now, as we look at the challenges that are before us, PPE is always going to be a bit of a challenge, but we have been able to stockpile some of that, and we hope that our hospitals have done responsibly done so as well. And so while that may become an issue again in the future, it is not the major issue right now. What is the issue is how many ICU beds do we have, and if you're doing some surgeries that require hospitalization, the likelihood that that patient ends up in an ICU bed is more likely than, say, if you do an outpatient surgery, for instance. And so it doesn't include all. It's a matter of preservation of hospital resources. And hopefully it's a short-term phenomenon, but we'll just have to see. Again, it's a very fluid situation. Yes, sir.
Knocking on wood here, but as we see cases go up, why would we not go to shutting? At what point would we need to go to shutting, like the whole state having this kind of mandate? We're in mass in businesses and stuff.
Well, the guidelines that we have put in place have us monitoring any county that has over 200 cases over a 14-day period, or 500 per 100,000 residents over a 14-day period. And so at what point will we add counties? It's when more counties get over that level and stay there for a period of time, which is not going to be an extended period of time. It's going to be a fairly short period of time. In fact, we had 3 or 4 or 5 counties over the weekend that hit that blip for a day or two of reporting, and we're monitoring those very closely. We could add counties as early as tomorrow if that's the decision that we ultimately make. For it to go statewide, from a mandate standpoint, we'd have to see significant more transmission in the other counties than what we're seeing today. Yes.
Jack with Clearing Ledger has another question.
Yeah, Dr. Dobbs, I apologize. I think you addressed this earlier, but my internet cut out. Do you have an updated number of the total amount of lawmakers who have coronavirus?
Yeah, I'm sorry, I had told Courtney Ann that I didn't have that with me. I'm so sorry. I'll check with the Epi department. We do have a couple more that were added, but I don't have a final count. We'll work on that.
For Director Michelle, when it comes to schools reopening in the fall, will MEMA be providing any PPE at schools to help slow the spread in those facilities?
So we've had a number of inquiries from the school districts about that. As I said earlier in my briefing, right now the PPE that we have been allocating is still for Tier 1 and Tier 3. That's not to say that we're not open to do that. Everything is based off of, our projections and the PPE that we've been buying. We can certainly look at that, but I've not had any discussions with Mississippi Department of Education on that. Again, we have had school districts ask, and I'm open to talking about it, but we've not planned for that at this time.
Just as a reminder, as we conclude today, those 13 counties that are currently under additional restrictions, including mask mandates, include Claiborne, DeSoto, Grenada, Harrison, Hines, Jackson, Jefferson, Madison, Quitman, Rankin, Sunflower, Washington, and Wayne counties. If you are in one of those 13 counties, it is a law in the state of Mississippi that you wear a mask. If you are not in one of those 13 counties, we still strongly encourage you to wear a mask if you are in a public setting, if you are around people, if you cannot socially distance. We encourage all Mississippians to wear a mask. We think it's important. We can slow the spread. We must slow the spread because we continue to have the same goal we've had for 5 months. We've been successful so far, but we need your help to continue to be successful. We want every single Mississippian who has the ability to get better with quality care to receive that quality care. For that to happen, we have to preserve capacity in our healthcare system. We need your help doing that. Thank y'all, and God bless.